I want to begin with your reaction to the governor in your state allowing the reopening of certain businesses, which obviously doesn't mean that those businesses will necessarily reopen and risk safety. What has been happening in Georgia so far?
Fortunately, very few people are taking advantage of this very untutored decision by the governor. We are the 8th largest state in the nation, but we have the 14th highest infection rate, topping 23,000 as of this week. We have the 7th slowest and lowest testing rate, meaning we don't even know how many people are sick. We are one of the states that has chicken processing plants. And so we've already had 4 deaths at processing plants that will now likely balloon because they don't have access to the adequate protections they need. And what we are hearing across the state is that we're not ready to reopen because our people are not safe. Luckily, businesses like restaurants and movie theaters are saying no. But my deep concern is the number of workers who are being forced back to work by employers who know that in a right to work state, if someone says no, they can be fired from that job. And these are low-wage workers who face either risking the health of themselves and their families or risking their livelihoods. And that's a choice no one should be forced to make.
What would be your guidelines about deciding when Georgia could begin to allow some places to reopen or reopen schools? What kind of progress would you have to achieve in Georgia to allow that?
We'd have to follow the facts and follow the science. That means that we have the ability to test. Georgia is a populous state, more than 10.5 million people. We have one of the lowest testing rates, so we don't know what we don't know. Number 2, we have a broken public health infrastructure. If people are tested, there's not necessarily somewhere for them to go to be treated. We have 9 counties without a single physician, and we have a number of counties without access to hospitals. And so I would ensure that we have the public health infrastructure that we need. And third, we need to be able to do contact tracing. That is something that we're just starting to hear about. But again, it only makes sense if we've done the testing necessary and have the treatment available to help the people we need to serve. Last Friday, I held a call with hundreds of Georgians to talk about what was happening in the hardest hit part of our state. And what I heard there is what is true across the state. We are not ready to reopen.